Acute respiratory distress syndrome is a serious lung condition that causes low blood oxygen levels. People who develop ARDS are usually ill due to another illness or major injury. Fluid starts to build up inside of the tiny air sacs of the lungs, and surfactant, it's a foamy substance made by your body that keeps your lungs fully expanded, starts to break down. The fluid buildup and lack of surfactant prevents the lungs from properly filling with air and moving enough oxygen into your bloodstream. Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be doing another 5-minute or less mind map. So we're going to be talking about acute respiratory distress syndrome, or ARDS for short. So as I was saying, ARDS causes inflammation compromising alveolar lining, okay? This is either caused by trauma or illness. The number one cause is sepsis, okay? Fluid fills the alveoli, preventing oxygenation of the body. The patient will be in severe respiratory distress, and it is often fatal. So as you can see here on the left-hand side, this is healthy alveoli, okay? There's no fluid inside them. Now, look at the walls here, the thickness of the walls. Okay, just look at that for a second and come over here. You can see that the walls are thickening and there's fluid inside of the alveolar sacs. And right here, this is where gas exchange is going to happen. So you can see there's so much fluid in here that not enough gas exchange can happen to properly oxygenate the body. So what are the signs and symptoms that you will be seeing in your patient? So you're going to see them have shortness of breath. Their heart rate and respiratory rate is going to increase because they're not getting enough oxygen. They will have a cough that produces phlegm. They will have extreme tiredness and confusion due to the lack of oxygen. Now, how do we diagnose a patient with ARDS? So we'll be looking at their symptoms. They'll have a chest x-ray or CT scan, arterial blood gases, and O2 status. Next, we have treatment. So how are we going to treat acute respiratory distress syndrome? So number one is oxygenation. We need to have their body have enough oxygen that it needs to properly function and maintain homeostasis. Mechanical ventilation, sedation, pain medication, antibiotics, and anticoagulants. So there you have it, another under 5-minute mind map, everything that you should know about this condition. If you are looking for more of these, I do have them on my Etsy shop. I have lots on there. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.